Welcome to Conversations with Zaki Baruti, with your host, Zaki Baruti. As always, we're going to have a very exciting show this evening. And in studio with me are two outstanding people of our community who are working to make a difference in our community around the issue of mental health in the African American community. In studio with me, I want to welcome Dr. Azfar Malik, who's the CEO and principal investigator for Psych Care Consultants Research. Welcome.
Thank you.
As well as the lovely Tiffany Bess, who is a business administrator for clinical research. Again, I want to welcome you to our show.
Thank you.
We want to just really, for each show, I always like to kind of have our audience, as millions of people watch our program, to get to know who our guests are. But before I do that, I need to digress. At every show, I always send a shout out to my biological family, as well as the Universal African Peoples Organization family, as well as to New Life Evangelistic Center family, led by Reverend Rice. But going back again, welcome. Share with our audience a little bit about yourself, if you will.
Okay, I'm Dr. Azfar Malik. I'm a physician, but specializing in psychiatry, and that means behavioral medicine. Presently, I'm the Chief Medical Officer at Centerpoint Hospital, which is a pure 150-bed psychiatric hospital, where we treat addiction, other forms of mental health, depression, schizophrenia, bipolar disorder, these kind of illnesses. I'm also the chairman for Psych Care Consultant, which is a physician group organization with about 80 providers all over St. Louis, including North County, South County, West County, and St. Peter's, where we treat a lot of patients who have problems with mental health and mental illnesses, including addiction. The third part of my job, which is also very important, is I run Psych Care Consultant Research, which is a research arm of the company, where we do clinical trials and research and innovation with new medications, new methods of treatment that patients can benefit from. Because sometimes in mental health, there's not enough treatment available for, or at least curing the disease. So right now we are in the process of finding the cure in a lot of conditions and also treating conditions where we can get people stabilized.
Okay, and Ms. Tiffany Bess, if you will share.
My name is Tiffany, and I am recently on board with Psych Care Consultants Research. I have more than 15 years of mental health experience, and I come to their organization from Washington University, and my focus is primarily recruiting patients to the clinical studies that we have.
Okay, so with that said, you know, mental health in the Black community, I think is a really appropriate subject here in this year 2017. Are there any kinds of differences between the mental health issues in the African American community versus other ethnic group? And if so, what are some of the contributing factors, if you will?
Yeah, so some of the factors that are important is provider-based. So accessibility of mental health providers in the Afro-American community or certain areas is not as well established as it is in other areas. The blame rides on the providers and to some extent the system itself. The second issue is recognition of the disease itself. Sometimes recognition of the illness, as we all get more educated, we learn more about mental illnesses and understand it's a biological condition, no different than having diabetes or having a heart problem. I think recognition and taking the taboo off is another issue, which I think the other communities have been able to do a better job. I think we need to work with Afro-American communities where they can recognize it. Not to say it is not, it is recognized, but it's still at a certain point, the recognition of the illnesses are not at the same level. So we need to educate, We need to work with them. We need to also increase accessibility for them to get help. Those are important.
Absolutely. And, you know, just most recently in the news was a police shooting in Seattle of a young African-American female who was previously diagnosed with mental health. And so within that context, I guess that reinforces what you just said as far as to really not look at that as something that we should not deal with, but as a community, we need to deal with that. Am my analysis correct on that?
Yeah, to some extent, but I think we also have to, I agree, but we also have to educate the law enforcement. Black or white or whoever it may be, but I think unfortunately it has been more Afro-Americans that have been subjected to it, because people with mental illness will react very differently to a situation. I think it's a recognition of mental illness and also recognizing that paranoia, for example, could be high, and somebody could be paranoid and running away. That doesn't mean necessarily that they are the worst criminals of the world that you need to shoot. I think we need to bring more awareness to it, how you two can subdue, calm people down, talk to them, and things like those. So though mental health itself is of concerns where people, law enforcement needs to be educated and people need to be educated. Simultaneously, that's a big task we all need to undertake at this time.
So within that context, Tiffany, how do you fit in within that context of dealing with mental health in the African American community?
With going out, providing the education of different diagnoses that people have, because a lot of times people are diagnosed with psychiatric issues, but are their physicians really explaining to them, you know, what that diagnosis is? And if they don't understand that, they don't know. So they have to have someone from the community or their doctor's office to be able to explain, you know, what that diagnosis is, how they need to treat it, as well as, you know, what they need to do to maintain in order to function on a daily basis.
Okay, on that note, we'll take a quick break and we'll be right back with the issue of mental health in the African American community. Welcome back to Conversations with Zaki Baruti, and in studio with me is Dr. Malik as well as Miss Bess, Tiffany Bess, and we're dealing with the issue of mental health in the Black community or African American community. On the flip side, we kind of dealt with a few of the challenges first, you know, that the African American community has around the whole issue of mental health and accessibility to resources. Would you kind of reemphasize those issues?
So accessibility to mental health is a concern, certainly for everyone in America, but more so for the Afro-American community. The reason is few-fold. One of them is provider base, which they need to have provider base that understands the illness. Of course, the real issue is beyond that is who's going to go to the provider. Only when you recognize, like Tiffany said earlier, only if you can recognize the illness, you are going to go with it. If you recognize the symptoms, rather than look at a behavior and think that behavior is something that is normal, then certainly you're never going to recognize an abnormal behavior. The third thing is really, which is a bigger issue, is beyond us, is the insurances. Some of the insurances may cover. Right now, it's mandatory under what we used to call Obamacare, that every insurance should. Now, we don't know what's coming down the pipeline.
Right.
But under Obamacare or ACA, mental health was at parity. That means you have to have mental health coverage. And you know, when it happened, not everybody in the world or everybody in every community recognized that it's a covered benefit. It takes time for these things to unfold. People to recognize that this is an illness. If I'm experiencing a sad moment or if I'm experiencing an abnormal behavior, families recognize more than the patient first. And families are the ones who encourage you to go and see a provider. Now, the primary cares are the first line of where patients go to, and the primary care sometimes, our job is also to educate a lot of primary cares to recognize these symptoms. And under ACA guidelines, every primary care was required to at least screen every patient for depression. Whether it was happening or not is a secondary issue. But I think those kind of efforts need to be made so people recognize it, educating the public, number one, which I think we need to do as a community, and the community needs to do on their own, educating the public about mental, and that's why our job is, as part of our organization, to sit down over here and talk about it. Recognize symptoms when somebody is having abnormal mood swings, somebody is overspending money, young people start using drugs, they may be having some underlying pathology, that means maybe depression, attention deficit problem, something like that, that leads to what we call self-medication. They try to medicate themselves. And these people are more prone to do drugs as compared to anybody else. So these are things we need to educate the community, the parents, and people. That's one thing. And otherwise, and then when they recognize it, we should be ready as a community to have accessibility so they have a provider who they can see.
So on that issue, in terms of accessibility to deal with mental illness, what are those available resources for that?
The available resources would be, number one, primary care physicians. Number two, psychiatrists or mental health professionals should be there. These are people who need to be there to be present so they can really evaluate them on the first go. Yeah, on the first go. These are important things. Sometimes even seeing a therapist initially may be helpful. Some kind of counseling, some kind of mental health trained person needs to be the front end for these things.
So it's one of the important lessons out of this discussion then is, as family members see a problem, they need to immediately go and reach out for help through some trained professionals. Yeah. Okay, then.
But and let me just say this. But the other thing is, they need to understand that mental health is no different than if you have cancer. Because if you have cancer, you're definitely going to go and address that issue. So with mental health, you have to do the same because, we want to make sure that we're functioning to full capacity.
And, with that whole spirit, so I think it's very key that people want to re-emphasize what you just said, that they should not really frown down. I mean, a mental illness is similar to
any other illness that you have.
Absolutely.
It's just affecting the brain.
The brain.
So put it this way, the easy way to look at this would be mental illness is nothing but a disease of the brain, and the brain is the biggest organ of your body. It's no different than a disease of the brain. People feel that if I'm emotionally weak, that's not true. Nobody wants to be. It's not like a muscle that's weak or not weak. It's a disease. It's an illness that needs to be treated.
Now, in terms of analyzing people with mental illness, I know there's a lot of clinical trials that take place. Explain why it's very important that members of the African American community are to participate in clinical trials. So explain what is a clinical trial and the necessity or the importance of participating.
So there are many kinds of clinical trials, right? There's a clinical trial where you are doing an evaluation or you're doing a screening, but there's a clinical trial where you are using medication to treat a condition. First of all, you have to recognize the condition. So what happens, why clinical trials are important, is we don't have enough medications or proper medications to treat every sort of disease. For example, addiction. In addiction, there are only 2 medications, or at best 3, I would say, which will help you with addictive processes. There are now research being done in looking at other drugs that can block your desire for a drug, for example, or a kind of drug. And different drugs have different effects, right?
Wait a minute, I'm sorry to interrupt you, but we'll have to take a quick break.
Okay.
Let's hold that thought, and we'll look at that thought on the other side. Welcome back to Conversations with Zaki Baruti. In studio with me is Dr. Malik as well as Tiffany Bess, and we're looking at mental health issues in the African American community. And we were looking at clinical trials on the other side of the break. Would you continue your thought as you was addressing the other issue?
Okay, so clinical trials are usually beneficial for people. Suppose somebody is being treated with medication. A lot of times certain medications insurance would not cover, and you are just not doing well. and you are being treated, or you don't even recognize you have symptoms and you're never being treated. So clinical trial provides you free medication and free services, including evaluation, treatment, and everything else. Now, they are limited time period, but we tend to carry patients over. If you have been treated, you have done well with something, we try to follow up at no cost to the patient too somewhat. But what clinical trials do also in a greater good for humanity is bring new products or new medications that may be useful in conditions that had never had medication available to treat, or even finding different ways, like doing mapping of the brain, figuring out what areas of the brain are affected in a certain disease. So these are kind of benefits of clinical trials. Sometimes it benefits the patient individually, but it also benefits the community as such. Because tomorrow, if we didn't have clinical trials, we wouldn't be able to treat any disease. By clinical trials, doing some products, showing efficacy, and showing, of course, that sometimes they can have side effects.
So within those clinical trials, one question that's come to my mind, do you have to have people with mental illness that's participating in the clinical trials?
Yeah, you have to. You have to have a certain illness, and I think that's what we do. We tend to educate people. Suppose we are doing a trial on schizophrenia, or we are doing a trial on bipolar disorder or depression. We'll educate what these symptoms are. So you will see a lot of people who have never had treatment, and there may be first time they've recognized that I'm living with these symptoms. Some of the time, patients who are being treated, but they are not treated appropriately because either they cannot see the provider because of cost issues, or they cannot get the medication because of cost issues. So we overcome those things by providing free medication, free evaluation, and cost is not. In fact, if anything, we tend to pay people for coming for clinical trials because they have to transport themselves, they go to a place, spend time, so we tend to reimburse them for their efforts and time too as well, and transport.
Just want to re-emphasize, audience, you hear that? Those of you who within your family may have problems with financing for medication, what have you, these clinical trials are free. Anybody who's interested, who's out there in the audience and would like to participate, how would they get in contact with you?
Well, I think I'll leave that question to Tiffany because she's the one who is at the end where she will talk to patients and bring them in and talk about what benefit it would be for them.
And as you get ready to address that, so there has been reluctance from the African American community in terms of participating in those clinical trials?
Correct.
Okay, then. So for those who are listening, how would they get in contact in terms of us opening that door?
For those interested in participating in clinical trials, can always reach me by phone, 314-603-7388. I'm available 24 hours a day, for whoever want to call and get information for clinical trials.
Would you repeat that again? We want to make it slow so that everybody can get it, and because this is very important.
I can be reached 314-603-7388. For those who are interested in participating in clinical trials.
And and again, I just want to emphasize as a social activist, there's a tremendous amount of violence a lot of times in our community, and I'm sure that if we were to examine a lot of the root of those problems, would you agree that it stems from the mental conditions of folks who are involved and participate in, say, violent acts and what have you?
I would absolutely agree. That's a music to my ears. Actually, if you look at the prison population today, majority of the people over there are suffering from some sort of mental illness. In fact, in the state of Missouri, our prison system is the biggest single provider of mental health care. We don't get the proper care most of the time, but majority of the patients who are there have had emotional, mental problems. And on top of that, there's data nationally which shows that the number of people with mental illness when they're doing drugs and alcohol are more optimal to be admitted to prison.
Okay, again, we're going to have to take a quick break, and we'll be right back. Welcome back to Conversations with Zaki Baruti, and we're getting ready to close out this segment of our show. I'm in studio with Dr. Malik and as well as Tiffany Bess, and we have been discussing mental health in the African American community. Any final comments that you'd like to share, starting with you, Tiffany, around that whole issue of mental health in the African American community?
The issues surrounding mental health are serious, and people need to recognize when they have issues or those around them. And it's okay to acknowledge and get the treatment that you need. So again, if you're interested in clinical trials, I can be reached at 314-603-7388 at PsyCare Consultants Research.
Okay, and Dr. Malik, we have about 2 minutes left.
I would suggest that get a chance, read about mental illnesses, mental health, whenever you can. Understand it. And certainly we are always open. Tiffany, call us up. Even if you don't want to get in a trial, call us up. We'll be happy to educate you. We'll be happy to bring you in, talk to you, do whatever we can. We are available. If anything, you can always call PsyCare Consultant if you need to see a provider, or you can call Centerpoint Hospital. We'll do free assessment and evaluations for you as well.
Well, you've been listening to Conversations with Zaki Baruti. And one last point, again, saluting Reverend Rice, and I'm sure there's among a lot of mental illness that affect homelessness. Would you, or people who are on the streets as homeless people?
It's 100%. There's no question. Reverend Rice is doing a great job. Unfortunately, we don't have enough of them. I think it's the majority of people who are on the streets, are homeless, have either mental illness or some kind of addiction problem. And most of the time, addiction problem is a comorbid problem. That means a problem along with mental illness. It goes hand in hand. So these are people where we really need to reach out and help.
So on that note, again, we want to thank you for being in studio with us and sharing with us about that critical issue. And I challenge each one of you that's in the listening audience, if you notice something that somebody needs some help, please help them seek professional help. On that note, again, want to thank everyone for tuning in. Make sure you let your family know that Conversations with Zaki Baruti comes on every Saturday at 11 p.m. God bless.